Live from WATN Memphis. Local every day. This is Local 24 News at 6.
Well, right now, 70 people are under quarantine in Shelby County for possible exposure to the coronavirus. Thanks for joining us. I'm Richard Ransom. Katina Rankin is off tonight. Only one person in Shelby County has tested positive for COVID-19, and we're told that patient is in good condition while being treated in isolation at Baptist Memorial. So let's walk you through the information as we have it tonight and why there's no need to panic. Today, the number of confirmed cases in Tennessee climbed to 4. In the U.S., more than 650. Health experts maintain the risk to the general public is low. But the CDC says now is the time to prepare responsibly for the eventual spread of the virus. Also tonight, we learned the confirmed Shelby County case did have contact with a Shelby County school employee who works at Treadwell Elementary and Middle School. Local 24 News reporter Brittany Moncrief joins me now with the facts presented at a news conference today. So break it down for us, Brittany.
All right, Richard, here's what we know about COVID-19 as it relates to Shelby County. One case of the virus was confirmed over the weekend. That person came into contact with 100 other people. More than 70 of those people are in a 14-day quarantine in this state and Mississippi. Now, this does not mean that they have the virus. One of the 70 is an employee at Treadwell Elementary and Middle School. That employee has not shown any signs or symptoms of the virus. They are in quarantine just in case, so if they do become sick, the virus won't spread. Shelby County Schools has created a task force to adjust to any changes in the virus. They have canceled all district-sponsored international trips for March and April. In the meantime, schools are expected to remain open. However, some parents did decide to take their children out of school today.
I wiped my children backpack down when I got them out of school. Sure did. Gave them gloves. Sure did. I can't take this home. If it is at the school, if it's not at the school.
The goal has been to prevent COVID from coming into communities. Once it's into communities, our second phase is containment, which is where we are in Shelby County. We know that the individual who was diagnosed has traveled, and we believe that they contracted COVID as a relative to that travel. Therefore, containment is the strategy.
And we also spoke with a physician at Baptist Memorial as well, who broke down some facts globally. That doctor said most cases have been predominantly among the elder population and males. Reported cases among children 10 and under have been almost minimal. And most of the deaths reported have been people in their 70s and 80s. And lastly, the virus appears to be more common in smokers than non-smokers. Now, keep in mind, health officials are monitoring the virus and learning more each day. Live in the studio, Brittany Moncrief, Local 24 News.
All right, thank you, Brittany. Nurses and doctors at Baptist Memorial Hospital treating Shelby County's only known coronavirus patient say they are taking every precaution, but they're not saying much else. Dr. Stephen Threlkeld is on the treatment team, but would not release information about which state the patient traveled to or anything else about how they contracted it. He said the patient is in a room where the air is contained to keep the disease from spreading. He also says others in the hospital are not at risk of getting it, and he agrees with advice from the CDC that the general public not wear face masks because they could do more harm than good.
Can even hurt because you touch the mask more often. If it gets damp, it can actually pick up things. So there's there's really no evidence that wearing those things in the general public in airports and so forth helps.
Only healthcare workers, as you see there. Aside from face masks, there's a lot of speculation about what you should do to not contract the virus. So we're breaking down the facts for you. What you should do is diligently wash your hands. Can't say that enough, especially after sneezing or coughing. Also, when caring for someone who is sick, before, during, and after preparing food, and after handling a pet or pet waste. The Shelby County Health Department advises scrubbing your hands with soap and water for at least 20 seconds. Meantime, Memphis City buildings are being wiped down with disinfectant. The Shelby County Jail and other buildings are getting the same treatment. Memphis Mayor Jim Strickland says it's a cautionary move, not out of panic. But Local 24 News reporter Mike Matthews says there are still plenty of you who say chill out.
It is tough to be in the public business these days if you own, say, a restaurant and you've got that coronavirus thing all over. Mayor Jim Strickland had lunch at a small restaurant called Flavor House. It's a black-owned business that's been in operation since the beginning of the year. When it opened, nobody thought of shutting down any businesses or stopping the traditional Memphis Black Restaurant Week.
We've been preparing since January for this week, so everybody feels pretty good about it. It didn't exist back then, right?
Not that we know of. It certainly didn't dominate the headlines. No reason to panic, says Memphis Mayor Jim Strickland, but plenty enough reason to use disinfectant on buildings.
We have a responsibility on the city side to maintain our city facilities in a clean manner and our employees, but I also look at it as just a citizen, and it's a concern. I'm just like everyone else.
If people stay in, restaurants and other businesses will also be victims of the coronavirus. We did a very unscientific survey, interviewing the first 2 people we ran into on Main Street. Hey, what do you think about all this talk about the coronavirus?
Oh, I think it's ridiculous. I don't know where it's coming up. I don't know.
Yeah.
I just think we all need to just keep washing our hands.
Let's call her skeptic number 1. So that means this is skeptic number 2.
I see why people are worried, but as long as you wash your hands, cover your mouth, stay home if you're sick, I think you're okay.
All this talk is not going to change Mayor Strickland's future plans with the Memphis Tigers basketball team.
I'm planning on going to the AAC conference tournament this week and to see the Tigers play in Fort Worth, and I'm still going.
Mayor Strickland says simply he's going to be listening to the health department to see what they say, and if they say do something, he'll do it. In Memphis, Mike Matthews, Local 24 News.
Probably some good advice. Well, symptoms between the coronavirus, the flu, and allergies are fairly similar. So tonight, we're looking at the facts to help you keep this in perspective. Coronavirus symptoms include fever, coughing, and shortness of breath or difficulty breathing. These symptoms may show up in 2 days, or they could take as long as 14 days to show up. Flu symptoms also include fever and coughing, but also include muscle aches, fatigue and weakness, chills and sweats, congestion, and a sore throat. If you have allergies, there will be sneezing, of course, an itchy nose, eyes, or even the roof of your mouth, a runny, stuffy nose, and watery, red, or swollen eyes.